Welcome to Horse Tales and Wives' Tales, a video podcast that dispels the horse tales and wives' tales common in the horse world while bringing education and knowledge to the horse owner. Your host is Chuck Potter. Chuck is a full-time farrier and inventor of such products as the Hoof Cinch and the Lift, and an educator, taking the time to talk at clinics and gatherings on hoof care and horse health. In this episode, Chuck is joined by Dr. Jan Doelle to talk about blood flow in the hoof.
Hi, I'm Chuck Potter with Horse Tales and Wives' Tales, and today we have with us Dr. Jan Doelle. And today we're going to cover the blood flow into the horse's hoof capsule. There's a lot of confusion about what can cause restriction and what can actually damage the hoof with pressure being applied to it. And so we want to kind of clear up how the blood actually flows into the foot and in and back out of the foot. So hi, Jan.
Hi, Chuck.
So can you tell us how the blood flow, how it comes into the hoof capsule?
Sure. So there's a digital artery and a digital vein that run along the back of the leg, and that's how the blood enters the foot. At the level of the pastern joint, it kind of divides into two different paths. One is a bulbar artery that runs to the back of the foot along the heel, and another branch also runs towards the coronary band, and that's called the coronal artery. That is kind of the main blood flow that enters the foot.
Okay. And so on this leg here, if somebody was looking at it, an actual live leg, your digital arteries are coming down here until they get to the base of the short pastern. So it'd be about here before they started to split off, and for your coronal artery it would be coming over this way. Your bulb would be back down this way, and then the distal phalanx one would be coming back in through here. So there's really, besides the coronal artery that comes here and feeds the top part of the coronary band and the upper part of the distal phalanx, is there any way to constrict that by just applying pressure to the front of the foot that's not attached to anything other than the foot itself?
There really is no way to constrict the blood flow. Most of the arteries and veins are in the soft tissues. Obviously, when the hoof cinch is applied, that's not affecting any of the soft tissues. And because it's applied to the front and the sides of the hoof walls, we're also not constricting any of the blood flow along the back part of the heels as well.
Okay, so let's take a look at, actually, I have a hoof here with a hoof cinch applied on here, and so the blood actually enters the foot, the main artery enters back here, and that's where we apply the attaching plate of the hoof cinch. So you get the blood flow coming in, the attaching plate attached, the pressure is actually being applied to the front of the foot just below the extensor process on the coffin bone. So we're down below the coronal artery. We're above the artery that feeds the distal phalanx, and we're actually pulling out on the hoof wall where the digital arteries enter the foot, right?
Correct. So in theory, we'd be increasing blood flow to the foot instead of constricting it.
And that's why we actually see the increased growth then in the hoof capsule, and that what we're doing with this stimulation that we do, besides just the pressure that's stimulating the coronary band, we're actually opening the digital arteries in the back of the foot.
Correct.
Okay. And is there any way, is there like casting and stuff like that? Do you think it's possible, by applying a cast where you're stopping all the movement, you've got a complete wrap around the capsule there, if you were to get that on and it shrunk up and got tight enough, you could actually constrict blood flow at that point?
Certainly, with casting foundered horses, you have to be very careful because you are applying a rigid structure around the entire foot. And depending upon where the pressure is applied, you could certainly affect the blood flow that comes in the back of the leg down to the foot.
Okay. And so I think that's all we really need to cover then for the blood flow into the foot. It's pretty straightforward. It's a simple, kind of a simple thing. But if you get people who aren't trained on the actual structures inside the hoof capsule, there can be so much confusion, and that's where the biggest problem comes in amongst people working on the feet. Whether it doesn't matter what their job is, whether they are a vet or a farrier, and that it's extremely important to know how the blood flow comes in the foot, because we've actually seen people have problems in barns because people look at it and say, oh, that's restricting the blood flow, or you get vets and farriers saying, hey, I'm not going to use that because that's going to restrict the blood flow, and it actually can't. It's not possible. So if you have any questions, you can contact us at hoofcinch.com, or you can call us. Our phone number's on the website.
88445-CINCH.
Coming up, Chuck and Dr. Jan talk about the frog as a blood pump.
The Hoof Cinch treats founder from a whole new angle.
It just forces that new growth along the bone, and it actually reattaches.
Unlike conventional founder treatments, the Hoof Cinch is applied to the outer hoof wall. It stabilizes the capsule and reduces pain immediately. In 12 to 16 weeks, horses can return to whatever they did before. Get the full story and watch a short video at hoofcinch.com. Don't give up on your foundered horse. Take the first step and learn about the Hoof Cinch at hoofcinch.com.
Okay, and then the wives' tale we'll cover for this episode too is about the frog of the foot. A lot, if you get into the natural world of the horse stuff, which we have nothing against, but there's just some ideas that are kind of true but not, like the frog being a blood pump for the foot. That's true, but not like people look at it. People, if you get into the barefoot stuff, they think the frog has to hit the ground in order for the pressure from the ground to actually circulate the blood in the foot. And that's not true. I work on tons of horses. Their frogs never touch the ground. They have really get a lot of mules and donkeys. Those frogs never touch the ground. And they're good, healthy frogs, so they don't need to have that pressure from the ground surface. It's actually from the bony column, right?
Correct.
Yeah, pushing down into the foot, and it pushes on the sensitive frog internally, and that's what will disperse the blood in the foot. It's not from ground pressure, and a lot of times ground pressure on too much of the foot there can get you into some serious problems. This is Chuck Potter with Horse Tales and Wives Tales, and if you have any questions, give us a call or contact us on hoofcinch.com.
Thank you for watching this episode of Horse Tales and Wives Tales. If you have a comment or want a question answered on a future episode, please drop us a line at podcast@hoofcinch.com.